Thanks for joining us today on the importance of the Pay for Success pilot, getting to project launch. Especially thanks for joining us after last week's holiday week. We're really excited to share this final all cohort and provider advisory group learning opportunity as we're closing out the formal training and technical assistance with the cohort this month. A special thanks to the Kresge Foundation for supporting this national effort to explore leveraging Pay for Success financing as a way to fund wraparound student support services that improve matriculation, persistence, graduation outcomes for underserved students. I know you all have joined this initiative to develop a capacity to better understand how Pay for Success can be used in higher ed to connect resources to impact for students. And we've spent some good time over the last 3 months talking about funding of Pay for Success projects, the evidence base of services in this space, how to deliver a Pay for Success pitch, and today we're going to talk about the importance of a Pay for Success pilot in getting to project launch. Today we're going to give an overview of the pilot and ramp-up phases in Pay for Success projects, and as we've done on other webinars, we will provide examples from previous launched projects. We'll conclude by talking about what we see as the benefits of using a pilot in higher education. A few reminders: we're recording the webinar and we'll post it to our website later this week. If you're not on mute, you could mute your line, that would be great, but please feel free to use the chat box as you let us know about the sound earlier if you have any questions or if there's any other challenges throughout today's webinar, but we'll save time at the end to talk and answer any questions that you may have. So here's today's agenda. And I am so excited to be joined by one of my third sector colleagues on the line today. Oscar Benitez is a director in our San Francisco office who has years of experience in developing Pay for Success contracts. He has a number of years of experience working directly with local, county, and state governments, focuses on establishing outcomes contracts to fund human services through implementation plans, pilot programs, performance management plans, and has helped raise public and philanthropic capital in order to do so. So today he'll share a little bit more about 2 projects that have launched in California and Oregon. But before he does that, I just wanted to remind everyone of who's on the line and who's here. We've been working with our state and system partners in Arizona, Colorado, Ohio, and Connecticut, as well as members of our provider advisory group. Heading into this phase and coming out of our convening time at the National College Access Network Conference, we had some goals to achieve, or we set out to achieve them. And so the first was that cohort sites would be developing a draft project hypothesis. The second was for cohort sites and provider advisory group members to understand a series of Pay for Success tools required for launch. We've shared and will share again an economic model, a term sheet, a template request for information, which was the last tool we shared on one of our learning opportunities. And following this webinar, we will share a template Pay for Success contract with some appendices that will support your contract design and implementation of Pay for Success initiatives. You'll see in the template that we call specific attention to our recommendation to develop a pilot, which is really why we're on today's webinar. And that will help us support our third goal, which is to create implementation roadmaps or work plans of next steps and help get state and system cohort sites from this TA to project development. And so with that introduction, I'm going to turn it over to Oscar to tell us more about Pay for Success pilots, what they offer, and then to talk through some examples he's led on while working at third sector.
Thanks, Sarah, for having me join. And if there are any other audio issues that pop up, please let me know or let us know on the chat box. But for now, I just wanted to thank everyone for allowing me to join. We, being Sarah's colleagues in our Boston office, San Francisco, and in Washington, D.C., hear a lot about the work that's going on with this cohort. So we're very much excited, not just to hear about all the progress you all are making in terms of trying to find a pathway to establishing an outcomes orientation in your own jurisdictions, but also being willing to also hear about some of our lessons learned since 2011, when we first embarked as a nonprofit advisory firm to do this work. And in my 5 years at Third Sector, the concept of a pilot has been really helpful in really transitioning from an idea and a theory to actual action that will help inform that vision, will help inform a theory for systems change. So on slide 9, you'll have a good sense of 4 examples that have demonstrated why it is worth taking a plunge into trying something new with a program with different agencies to help inform the planning process. One of the things we learned years ago is that if we spent a lot of time just designing and drafting planning documents, it can be very easy to get caught up in the weeds and get caught up in the paralysis of over-analysis. Many of our clients, beginning, I would say, in about 2013, have actually conducted parallel processes where they have done a lot of upfront planning work around financial modeling, understanding some of the data that an agency is able to access and integrate, and use that as a foundation to then say, all right, what program are we looking to start? What program are we looking to scale? And by engaging in a pilot, they are then able to kind of go back to their planning document and say, oh, in the real world, referring a client from this community into this program was actually much more difficult than we initially wrote. Enrolling a particular participant into a program requires input from these different decision makers in an agency. It's not as simple as saying follow steps 1 through 19 as laid out, across 3 pages in a document. At the end of the day, we have found that pilots help the different stakeholders involved in the process truly test out, the process and learn from it. So these are really the 4 examples of value that many of our clients have shared with us and that we in turn would like to share with you. And today we'll be focusing on 2 specific examples out on the West Coast. The first one being in Alameda. So perhaps we can turn to that page to give folks a sense of what took place in Alameda County. On slide 11 is an overview of a project that has been led by the district attorney in Alameda County. Alameda County includes the cities of Oakland and Berkeley. And while those cities have been known for a number of progressive values that those governments have adopted, a lot of those values haven't necessarily trickled down to the community. So in our work with the district attorney's office over the last 3.5 years now, the challenge was that there was a lot of state money that was being provided to the 40+ counties in the state to support reentry programming. The problem was that the recidivism rates weren't changing. They're remaining stable. We did a lot of work with the county to understand what are the baseline recidivism outcomes of people that have committed prior felony offenses and being caught up in the system once again. And a lot of the data showed that people were recidivating at a rate of over 70% within a 2-year time frame. So the district attorney's office was willing to think about how do we actually implement justice reform in ways that aren't overly reliant on incarceration. And then number 2, allows community-based organizations to leverage case management and wraparound services to address the life needs of prior felony offenders in ways that reduce criminogenic behavior. So what we supported the district attorney's office with is to develop a program for 150 young adults, ages 18 to 34, with prior low-level felonies. And you can think of these low-level felonies as non-violent, non-sex, non-serious crimes. And the services that the DA's office was looking to scale was actually a case management and navigation support program that is led by coaches that have similar lived experiences as the participants. And the effort was led by a service provider in the community, La Familia Counseling Services, that has done extensive work throughout the county in a number of areas of substance use disorders, case management, behavioral coaching, so on and so forth. The state of California and the county contributed to the $4 million project budget. And one of the big question marks going into the project was, how effective will a case management navigation support program led by coaches be in effectively reducing recidivism? That was the big question. Many members of the community knew that this intrinsically made sense, but the service provider itself had never actually had the recidivism data to back their track record. So there's an evaluation that is currently being done for this project to assess not just the recidivism outcomes of the participants that are involved in the project, but to also help integrate all of the administrative data sets in the justice area with the data sets that the service provider maintains as a way to build a continuous feedback loop. In terms of timeline, we started planning for this effort in late 2016. A pilot took place in 2018, in the first half of 2018, and the project formally launched in the fall of 2018. So we're actually a year into the project. And the effort here was focused on really two pieces. Number one, there was an explicit target to enroll up to 150 individuals into this program. And because the program is voluntary, there was an explicit incentive to reward the service provider for simply enrolling participants into the program, because there's a lot of community outreach that that's required. And then second, there's an incentive in place to actually make payments to the service provider contingent on the recidivism reduction that occurs for the participant group that is enrolled into the project. And that recidivism reduction is defined as a reduction in arrests, number one. And then number two, that reduction is actually being measured compared to a control group that was established by the evaluation team. So in summary, there's about $1.5 million that will be contingent on the delivery of those two outcomes of enrollment and recidivism reduction. The way this project is being funded for in the implementation phase is through a social impact investment being made by a community development finance institution named the Reinvestment Fund that is fully funding the service delivery of La Familia. And the Reinvestment Fund would be repaid for the funds that are dispersed contingent on La Familia's performance. So this is very traditional in terms of how you set up an outcomes contract with a social impact investor. The pilot itself was funded by government and with philanthropic support. If we can go to the next slide, I can give you a good sense of why the team decided to engage in a pilot and why it made sense to not jump straight from planning documents to implementation. So with regards to referring clients, so in this particular case, prior felony offenders that have been rearrested for a new felony charge, the biggest challenge here was actually government understanding what role it plays in the formal referral process. So more specifically, if the police department is making arrests and it is the district attorney's office that ultimately holds jurisdiction over how to convict a charge, we needed to actually understand what role the DA's office plays, what role the courts play, and then ultimately, what role does a service provider play in engaging with a potential participant into the program. Because this was the very first time the district attorney's office was trying something like this, whereas the status quo was someone would be incarcerated for a short period of time and then put on probation, we actually needed to warm up the system in understanding, okay, at what point do you deviate from reincarceration? And this was very challenging from the DA's office perspective, but also from the court staff perspective. What we learned is that a lot of the data that is used to refer participants of this project, and anyone really that's rearrested, was really being used for compliance purposes and reporting to the state. The data wasn't really used to understand what are the life needs of an individual upon rearrest. Yes, there were a number of intake forms and assessments that were, that are conducted when someone's held in custody, but that information lived in different silos. The behavioral health folks kept the information, on their side of government. The justice folks held the criminal history information on their side of government. So there's very limited integration. So in terms of decision making, there were decisions to be made on how that information is to be integrated, number one. Number two, there were decisions to be made at what point do you actually seek that input for a potential participant into the program. As you can imagine, it's not very easy to do it, especially when you're coordinating with the DA's office, court staff, and obviously the number of officials and staff members inside the jail that conduct the intake. The second challenge here was just broader education and coordination, which goes hand in hand, right, in understanding who is responsible for what. This may seem simple, but when we were actually drafting the documents, this was detail that was fleshed out in about 5 pages because it made sense to all the participants that are part of the planning process. And although the planning process was fully inclusive, you had representatives from the service provider, you had representatives from the district attorney's office, you had data folks involved from the district attorney's office, you had the evaluators involved, you had third sector involved, you had the county's procurement staff involved. It was fully participatory. You even had an advocacy organization that works in the community involved in the discussions. What was on paper actually didn't come to fruition for a number of reasons. We just highlight 2 of those challenges here. Some of the actions that were taken there is that we recognize that by initiating a pilot, meaning we literally started enrolling individuals into the program, that not everyone was well understood what was in the planning documents. The court staff interpreted certain terms and descriptions very differently from the way district attorney's office did so. So there were customized internal education documents that were put together just for court staff. There were other documents with the very same goals, but with different messaging set in place just for the public defenders. There were other documents, again, same content, just different framework, put together for potential participants and their family members. The same thing also applied for the service provider. So you have to customize the messaging. The second component to that is that there were hands-on face-to-face training that was required for the referral process. This was the case not just for probation officers, but also for court staff. One of the interesting things about the pilot is that when we first initiated the pilot, the goal was to try and enroll somewhere between 20 to 30 people for services. The referral process was so slow that only 12 people were enrolled from the very beginning. So we met about half of our goal. So we recognized that we also needed to improve the pace of enrollment. Had we just launched from the very get-go, based off of the planning documents, we would have been behind the 8 ball from the very, very beginning. So this actually speaks of some of the project enrollment challenges that we faced, and we lay this out on the bottom half of the page on slide 12. One of the challenges with the timing of from referral to enrollment simply had to do with the fact that there were some clients for the project that were being released from custody prior to being enrolled in the program. Everyone had determined from the very beginning in the planning phase that all enrollment should take place prior to release from custody. But when some of the processes, didn't really trickle down to all the staff, people were being released into the community. So what that meant for the service provider is that they actually had to enroll people on both sides of the equation. There were staff that were engaged with intake prior to custody release, and there were other staff that actually had to go into the community and identify individuals that perhaps may have been released, late at night from custody to try and enroll them into the project. So cleaning that up, right, and streamlining that process required a pilot. So you actually saw the individuals, the time frame, and also the repercussions, right, of not being able to identify a person that's eligible for this program prior to being released. And then the second challenge that I already mentioned here was that there's just a low level of enrollment. So there were a number of adjustments that we had to make with regards to eligibility criteria. Specifically, what type of crimes need to be flagged, or what type of alleged crimes need to be flagged by charging deputy district attorneys at the far ends of the county up to the main office, so that the data record of an individual is already flagged with participation into the program. So this is all really in anticipation of someone coming into custody, going through the legal process. That was big. And the other big lesson learned that came out of that is that while 18 to 34-year-olds were eligible for the program, there were a number of unmet needs in the community that really made a value statement for the district attorney's office to try and prioritize 18 and 24-year-olds for enrollment as a way to ensure that this program was more preventative in nature than reactionary. If we can go to the next slide, this is simply a takeaway in case you wish to share these materials with other folks in your office, of what was learned by going through the pilot process as it relates to referrals and enrollments. So for the district attorney's office and the broader justice system in Alameda County, mapping the referral decision-making process was really, really important, not just for education purposes and broader coordination, but also to validate the initial assumptions that were made, over a 2-year time frame during planning meetings. The second concept here has to do with really the use of data. So how is it that charging deputy district attorneys are using information that are written either in police reports or in their own internal documents? How is it that information is actually being integrated with the broader goals of the project in terms of all of the justice information that the district attorney's office holds, the courts hold, so on and so forth? That really made the process much more effective in being proactive in understanding when someone will come to court. And when someone comes to court, the project was then, during the pilot, able to coordinate with the service provider to have a staff member from the service provider in the same courtroom as a participant would appear. And at that point, you would conduct intake. That's much more efficient than waiting for someone to be released from custody and trying to find them in the community. And then lastly was just actually performance. There were so many challenges that were faced during that first pilot phase that everyone around the table said, you know what, we should have a second phase of this project, a second pilot, which they called the ramp up. And it was during that ramp up phase that they said, you know what, during a specific time frame, our goal should then be to enroll 12 new additional individuals over this specific time frame. And if we meet that goal, then chances are that we have improved our referral and enrollment processes. in which they did, by the way. So it was very successful for the county to work with their partners, not just through one pilot, but through 2 pilots over a 6-month time frame to understand where the operational gaps were. Once those were identified, to then correct them in the second phase, which they call the ramp up. Another effort that third sector supported with for a couple of years, actually, it was about 3 years, is in Lane County, Oregon. So this is in Eugene, home to the University of Oregon. And one of the challenges that the state was increasingly facing was that there were a high number of men and women that were formerly incarcerated in state prison that were homeless upon returning to the community. So there was this cycle of recidivism that took place where homeless individuals were being rearrested for a number of reasons. On one end of the spectrum, essentially for living outdoors. And then on the other end of the spectrum, for folks that had unaddressed substance use disorder, any other type of coping behavior that was taking place, folks were being rearrested. And what a lot of our work in Lane County started on in 2017 was actually trying to understand the baseline. So for this particular population, what are the recidivism outcomes? And what we determined is that over a third of individuals that are determined to have a medium to high risk to recidivate are being reincarcerated due to a felony conviction. So it's pretty different from what was taking place in Alameda. If in Alameda you had a 70% rearrest rate for folks, you had over a 30% reincarceration rate due to a new felony conviction in Lane County. So that was the broad challenge that was taking place in the county, is that, and also throughout the state, that there was no coordinated effort between reentry services and housing resources that was deliberately focused on recidivism reduction. So we worked with a service provider, Sponsors Inc., the local housing authority, Homes for Good, and the county's parole and probation department to establish a housing first permanent supportive housing effort to house 100 individuals. Similar to the Alameda project, there's also an evaluation taking place to assess the impact of permanent supportive housing in reducing two important outcome metrics. The first one is how effective is permanent supportive housing in reducing reincarcerations due to felony convictions. And then number 2, how effective is permanent supportive housing in ensuring stable housing, not just within a permanent supportive housing facility, but also in the private market. So this was a program that relied on a pilot for over a year. It was about 1.5 years, beginning in early 2017. And then in the fall of 2018, it launched. So that program is also 1 year in. There are $3 million that will be paid from the federal government, HUD to be specific, to the project, contingent on the rate of reduction in recidivism and the number of days of stable housing that's achieved for the participant group. In terms of challenges, I'm going to focus on the operational and stakeholder challenges. There were similar referral and enrollment challenges faced in Lane County as what you heard in Alameda. So it's not that there weren't those, we just thought it'd be helpful to highlight some of the operational stakeholder challenges. So from an operating perspective, Sponsors has had a long history in providing reentry services and permanent housing to the formerly homeless or those that are currently housing unstable. What the service provider had no experience doing actually is providing housing first permanent supportive housing, meaning permanent supportive housing without any preconditions. That was brand new for the service provider. They were aware of what was required to transition from providing transitional housing, mentorship, but fully integrating intense case management with housing first permanent supportive housing was brand new. So there was very limited track record. While parole and probation and the housing authority felt very confident that the service provider could deliver, the pilot period, which was funded by a grant from HUD, in addition to funding made available by the county and the service provider, by the way. They also put in money into the effort. They wanted to test it out. What does it mean to actually have eligibility criteria that honors the value of housing someone without any preconditions? As you can imagine, that plays a pretty broad role. There were a number of folks in the population group that we helped the team assess that had prior sex crimes. And one of the challenges that we faced was that people with prior sex crimes are unable to use Section 8 vouchers or other forms of federal support. So we needed to actually use the pilot period to figure out how is it that we can house folks that have that type of history without actually excluding them from the resources that are being made available. So again, this was the pilot in this particular case was of most benefit to the service provider in making sure that they were able to accomplish that, which they indeed were able to do so. The second operating challenge that they had in Lane County just had to do with accessing data. So one of the important takeaways from this effort was, although the conversation was focused on reducing recidivism, as the team did more work, they recognized that there are a number of healthcare benefits that were being achieved for this population. Over 90% of the potential eligible population in the county is on Medicaid. And we knew that shifting from urgent care to more appropriate uses of healthcare, which are preventative in nature, was just better, not just for outcomes, but also for the system. That's where the healthcare system was looking to transition. The challenge was that neither the service provider or any of the housing or justice entities had ever integrated their own respective outcomes with healthcare outcomes. And when I'm talking about healthcare outcomes, I'm talking about specific claims data on the use of emergency room, on inpatient stays, pharmaceutical care, primary health care, in addition to any behavioral mental health services that were used. So just the mere process of accessing and integrating information, in theory, sounds great, but the pilot actually created a use case to integrate that information, review it on a recurring basis, to then understand how services can be tweaked throughout the duration of the intervention. So in order to do so, there were a number of data sharing agreements that the various agencies needed to agree to and sign, number one. Number two, because these agencies had never integrated the healthcare information with the justice information, the housing information, everyone actually needed to understand what are the baseline outcomes of this population in the absence of housing. Like, what is the status quo? So doing that baseline outcomes analysis enabled everyone to actually understand, how do we define success? What do we aspire to get to relative to how the system is currently performing for this population group? That entire planning process was really instrumental, because it wasn't just the healthcare and the justice and the housing folks that were involved from a programmatic perspective, but the service provider played a proactive role in informing that dialogue. And in terms of stakeholder engagement, I think in the interest of time, I'll mention 2 points that were really important. The first one had to do with the type of housing that would be made available to clients. Because of the restrictions on prior sex crimes that were tied to federal resources, we actually created a portfolio of housing units that would be accessible to potential participants that were either secured through the private market, through public housing or affordable housing, or on site units that the service provider actually owns and maintains. It's not using federal funds. So there was just a very strategic solution to a challenge that was identified early on that everyone at the table needed to agree to. And the second, and this is the most important point, is because the state hadn't necessarily integrated justice and housing funding on a particular population, everyone determined that moving forward, a sustainable funding plan needed to be developed in partnership with either the governor's office or the legislature. So in order to do this type of work, there were recurring working groups and advisory committees established to review the information on a monthly or quarterly basis coming out of the pilot and also coming out of the first year of the program. That essentially enabled a shift in the way these different organizations work together, and it initiated a culture change in how data is viewed, not just as a reporting compliance-driven process, but as a way to help inform the service provider on how to improve its services while delivering the intervention. And then more importantly, it kept the key stakeholders at the state level informed on how the project was moving along. Without the pilot, as you can imagine, there would have been a number of hiccups that would have had to be addressed on the fly, while the service provider was really on the hook for performance. So it's for these reasons on slide 16 that we highlight some of the big takeaways coming out of this project. The first one has to do with improved data access. It sounds simple, but at the end of the day, pilots enable a lot of the data coordination to have a use case, a reason to integrate, a reason to act with a specific timeline. Otherwise, it's very easy for that stack of paper just continue to stack on someone's desk without an actual action plan. The second two are related. So establishing a plan for accessing and integrating information is as much of a technical exercise as it is in making sure the key stakeholders around the table understand why we are integrating the information. Both for Lane County and for Alameda, data integration was required to identify the appropriate individuals that are suited for the project. So thinking about eligibility and referrals and enrollments on the front end. But then on the back end, validating the impact of the project in terms of outcomes, right? So the lasting impacts after someone has completed a program or is currently in the program, not just relying on headcount as a way to articulate impact. So I'll pause there, and I'll turn it back to Sarah. But we want to give you a sense of what took place in two projects that skewed towards the more traditional pay for success social impact bond processes, but the values of outcomes orientation still came to fruition.
Great. Thanks for that overview, Oscar. So as Oscar was telling the story of the Alameda and Lane County projects, and specifically talked about how there was some cross collaboration across groups that don't normally interact, that, you know, getting from an idea to the planning documents to the project, there really is such an advantage to having a pilot as it supports your operation and implementation plans, and all of the continuous improvement and learning that was achieved in the pilot process. You probably had some wheels turning on your end of the line, thinking about how a pilot period could be really essential in a higher education pay for success project. We've talked about pilot periods being essential because it allows for course correction in some critical areas prior to project launch. In higher ed, especially as we're thinking about developing new relationships between institutions and providers, or service models that may be tested for a new student population, there are such a number of reasons to consider developing a pilot as part of your implementation plan before building it into your pay for success contract and ultimate project. As Oscar talked through, pilots are really critical to understanding, who's being served in the project, how they're enrolling, and ultimately how they're thriving. Pilots offer opportunities to validate target referral estimates and refine focus eligibility criteria. And moreover, I think, as Oscar started to talk to at the end, pilots help partners work through operational processes and challenges, as well as engage new stakeholder relationships. So on slide 19, we've bulleted a few different reasons for partners exploring pay for success in higher education to consider using a pilot period as a way to help build toward the successful launch of a pay for success in higher ed project. With that, I'd love to open it up to questions, and barring any sound issues, hopefully we'll be able to get a few good ones in the phone before we wrap up at the hour. So feel free to drop something in the chat box, or I'm happy to go back to a slide that Oscar talked to, or answer any questions about pilots you may have at this time. I have a question that this may prompt some others, Oscar. You had talked to the fact in the Lane County example that the pilot was funded by a HUD grant, the county and the provider actually had kicked in some as well. And given that we've got several members of our provider advisory group on the phone, I'm wondering if you can talk a little bit about that funding process and why that makeup of funders was a real unique one in the Lane County example.
So a couple of things. The first one is that all of the project partners, so the service provider, housing authority, and Lane County Parole and Probation, they recognize that they needed technical assistance just to project manage the effort. And we at Third Sector were very fortunate to have secured funding for that work. There was just a dedicated team of 3 individuals supporting the day-to-day. What these organizations recognize is that they had different budget line items to draw down on to support service delivery. And whether or not that service delivery was through a pilot or through the formal launch phase of the project, they had flexibility to find that. They didn't necessarily have flexibility just for the technical assistance piece. So that's just kind of an important one that we as a project team in Lane County immediately recognized. Number 2, the service provider essentially recognized that it was important to demonstrate some sort of progress in their adoption of housing first, permanent supportive housing for the long term. So they were willing to invest their time and efforts. We're talking about less than 100K worth of funds. I don't know the exact amount. So we're not talking about millions of dollars. We're talking about less than 100K, which is still material, but important in funding the staff positions, the project management that internally was taking place during the pilot, because they knew that that investment in time and resources would build the capacity to actually carry this type of work for numerous years as a direct contract with government. So there was a very clear alignment of incentives. And then in terms of the county itself, I mean, the county was interested in improving the outcome of recidivism and stable housing. So when it came to understanding, okay, what resources can the housing authority provide in terms of Section 8 vouchers, in terms of establishing a priority for people on the wait list throughout the entire county, but specific for this project, right, to secure housing, to get the project off the ground, there was a clear alignment from their perspective and also understanding the long game. So the pilot phase itself enabled everyone to literally try out what they had agreed to in writing, and to identify those different funding streams or specific line items that they can rely on to frankly braid funding to support the pilot phase. Does that answer does that get to the level of detail you're looking for, Sarah?
Yeah, I think that helps. And there's a related and somewhat more specific question coming from the team at Arizona State University, who were actually asking about how open funders were to adjustments made during the pilot. Did it affect payment? I guess just wondering, to your latest points around that alignment and flexibility, what that was like in either example you shared.
Yeah, that's a great question. So for both projects in Alameda and in Lane County, during the pilot phase, there was no payment based off performance. The pilot phase in many ways was standard delivery of services. There was no performance piece, meaning a specific delivery of outcomes that would then trigger, repayment. So that's number one. Number two, so the funders were different for both projects. For Alameda, those are philanthropic funds that were used for both phases, the pilot and the ramp up. The funders were incredibly willing and able to understand that this wasn't going to be perfect and that we were going to have bumps in the road, but they wanted to support the progress that was being achieved. So the funders for Alameda were actually, I'm trying to think, yeah, they were all California-based philanthropic organizations and federal, actually. The James Irvine Foundation, the Nonprofit Finance Fund, and then SIF, which is run through federal CNCS, Social Innovation Fund. And what's actually really helpful about the Alameda project is that after the first 3 months of the pilot, we were able to report back to philanthropy and say, look, these were the challenges that were discovered during this phase. We intend to address those challenges in a subsequent phase. Can we extend funding or renew funding to address those challenges, right? And all those funders were definitely amenable to that. So that's what it looked like in Alameda. On the Lane County front, the funding for the pilot, there it was primarily self-funded, right? The service provider and the county. And the flexibility was very similar to what I described in Alameda. I think the difference is in Lane County is that you weren't necessarily applying for funds because the decision makers were at the table that also made the decision makers for the project were also decision makers of, for their own budgets. Yes, there were some philanthropic funds secured in Lane County from healthcare specifically the coordinated care organizations that are the local administrators of Medicaid, that were interested in integrating some of the healthcare information into the project. And those grants were between like 100 to like 300K. But it wasn't like the substantial portion of the pilot funding.
Great. Hopefully that helps Team ASU. And if you have other questions that come to you offline, please feel free to email them or get in touch with me this week. As I started this webinar by saying, we're planning to share the template Pay for Success contract at the end of this week or by the end of this week, in addition to the recording of this webinar. You'll see in the Pay for Success contract that we've annotated the tool in the margins and specifically call out developing a pilot, as well as a number of other areas where stakeholders may consider the positions that they'll want to take as part of the negotiation and other parts of the contracting process. We hope you'll see how these projects have utilized the pilot period is helpful in helping your team consider what you may want to learn or test in a pilot phase of your Pay for Success and Higher Ed project. I think, assuming that there are no more questions and to wrap up on time, I'll just quickly come back to our timeline here and we'll call out a specific change that has been made since the last time. So next Wednesday, December 11th, we'll be hosting our final all cohort virtual convening and project wrap up. The policy director at America Forward, Roger Lowe, is going to join us to offer some remarks on the state of the field and how these Pay for Success projects are a part of a broader movement. Then our state and system partners will share their reflections and some of their next steps, and we'll provide a high-level summary of some of the provider and funder landscape assessments that we've been conducting. As always, please feel free to reach out if you have a question on any of the tools or resources that we've shared so far. And one note is that the provider closeout conversations, thank you so much to all the providers that have submitted their information. We'll be sure to give a high-level summary, but wanted to make sure that we can have those provider closeout conversations without too many scheduling conflicts around the holidays. So we've pushed those to January, but we'll certainly be able to share kind of what we've learned from your programs and have some conversations in the new year, as well as do another few connections with the cohort as interested. So again, thanks for following us along this journey so far. Thanks for joining us on today's webinar. And as always, feel free to get in touch if you have any questions, but enjoy the rest of your day. Thanks so much, everyone.